Myobrace is my favourite because I can treat any kid, any age.
No chance of fruit on your teeth.
Doesn't hurt. Looks cool.
Such a simple system.
No wires to tighten.
And works like braces.
I love the Myobrace.
The Myobrace is a new concept in orthodontic treatment, incorporating high-tech design characteristics to align the anterior dentition and the mandible into Class 1. This flexible appliance features individually sized tooth slots and dynamic core, the active inner core enabling controlled arch development. The Myobrace is suitable for most children currently in the mixed or permanent dentition requiring orthodontic treatment. MRC continues to lead the world in the application of advanced design technology within the field of intraoral appliances for orthodontics, TMJ treatment, and sports mouthguards. With the introduction of the Myobrace, MRC is now also at the cutting edge of dual-molded appliance technology.
The Myobrace is a new concept in orthodontics that shares some time-proven characteristics of various traditional appliances. We're already familiar with the occlusal guide, Invisalign system and TP positioners. These are all prefabricated with individual tooth slots made to align or retain the teeth. They all come with their own advantages and disadvantages. Too rigid, too soft, poor patient compliance, multiple appliances. The problem is they are all limited to one base material. An overly hard material gives good rigidity but lacks comfort for the patient. A soft material provides flexibility and comfort but lacks insufficient force.
The Myobrace comprises two main elements, a hard inner core and a soft flexible outer area. The pre-molded arch form of dynamic core produces arch lengthening by correcting the anterior arch form. The dual mold design overcomes the problems of the past, allows for better compliance, and also provides more actively functioning orthodontics. Also incorporated are the well-recognized myofunctional training characteristics from the MRC trainer system and its counterparts.
Invisalign and MRC have identified a substantial market demand for orthodontics without brackets. Invisalign has focused solely on the adults. The Myobrace is directed primarily towards the adolescent patients.
I don't like braces. They hurt and look yuck.
I wear it every day, it works great, and I've still got a life.
Due to the nature of removable appliances, patient compliance is essential. Therefore, it's important to select motivated patients and parents. If motivation is a problem, it may be better to stick to conventional fixed brackets.
The doctor selects the appropriate Myobrace by measuring across the 4 upper incisors. The appliance is available in 6 individual sizes, which cover the majority of everyday cases. After the appliance is fitted, it is only down to a routine review to assist in assuring that the treatment is going in the right direction. One limitation of the Myobrace, with its tooth slots and hard inner core, is that it doesn't always fit the patient well at the start, when the malocclusion is at its most severe. This is normal, but is a commonly known problem with positioner appliances. For this application, MRC has introduced the Myobrace Starter, or MBS, specifically designed for use prior to the regular multi-sized Myobrace with tooth slots. The MBS features a softer, more flexible dynamic core and comes without individual tooth slots. The MBS can be used with these more severe cases for the first 6 to 12 months. Well-known researcher in craniomandibular development, Dr. Herman Ramirez, has closely studied the development of the trainer system and more recently the Myobrace system from MRC. Here he explains how the Myobrace works.
Because the Myobrace has all the characteristics of the trainer. It produces a relocation of the mandible, it stimulates a transversal dimension, and it also focuses in treating the soft tissue dysfunctions. It has a further step. With the Myobrace, we can produce some forces on the teeth, directly on the teeth. And it has been demonstrated that we don't need too much force to move the teeth. We need only 1.7 grams to move a teeth. The dynamic core is producing the force on the teeth. So it is what is gonna produce the tooth alignment. And the other characteristic, like the buccal flange and the flange for the tongue, is gonna correct the soft tissue dysfunction.
It is expected that the Myobrace will fill an active role in the conventional orthodontic age at 11 to 14 for children who have a desire not to use brackets for minor orthodontic problems.
No matter who you ask, children prefer to be treated without brackets. Many orthodontists feel they don't get an ideal result solely with fixed appliances because the underlying myofunctional and orthopedic issues are not resolved.
The Myobrace combines dental alignment, active arch development and myofunctional training in one easy-to-use appliance system.
Doesn't hurt, looks cool, and works like braces.
Myobrace straightens teeth.
Myobrace is my favourite because I can treat any kid, any age.